hot on the heels of understanding what the blueprint is and what advocacy can look like in the future, I now have the privilege of introducing three of our NPON Standing Committee members to talk about advocacy, some of the wins, some of the challenges, and what perhaps it looks like moving forward as Trent says, with a blueprint, with a roadmap, and a bipartisan commitment from government to actually bring the patient voice into the centre of everything that they do, and to be able to give us the opportunity to bring therapeutics, medicines, technology, etc., to the table a lot faster. So our panel today, three extraordinary women who are working tirelessly in their organisations and bringing forward their voice. So I'd like to introduce, first of all, in our panel, Dr. Amanda Ruth. Amanda is the Head of Policy and Public Affairs for Rare Cancers Australia. And she has a very comprehensive understanding of the Australian and New Zealand healthcare system and very strong relationships with stakeholders right across the sector. So good morning, Amanda. Thanks for joining us. Also on the panel, we have Fiona Ellis from HeartKids. Fiona is the CEO of HeartKids, is passionate about building strong stakeholder relationships as well to make a real difference in the lives of children and their families. Fiona has a diverse background, brings significant experience from marketing and advertising and tourism, aged care and disability. She's worked in government, commercial business and for purpose sector and organisations small and large, and is a member, as I said, of the NPON Standing Committee. So good morning, Fiona, welcome.
Thank you.
And our final panel member is Agnes Nsofwa. Agnes is from the Australian Sickle Cell Advocacy. Agnes actually created the Australian Sickle Cell Advocacy following a personal experience with her youngest child being diagnosed with sickle cell anemia in 2009. So Agnes brings as well a passion in terms of support programs and initiatives to enhance lives of people from disadvantaged backgrounds. And is a registered nurse and data analyst by profession, working in the aged care industry as well. So good morning, Agnes, welcome. So very experienced, very capable advocates right across this panel. So we're going to be able to, I'll be asking each of you just to reflect on some of the advocacy wins that you've had and maybe some of those challenges or wooden spoons, and whether there's a formula or a secret to the success, or whether in some cases it's just good luck. So we might start with you, Amanda. What are some of the wins and some of the challenges that stick out for you in terms of advocacy?
Yeah, thanks, Fiona. I hope you can hear me. I've had to change from headset to audio, so I've had a few technical glitches already. Look, I think from my experience working for Rare Cancers and the National Oncology Alliance, there's two sort of very different kinds of advocacy that we look at, and the one is sort of individual patient advocacy, where we're advocating for the needs of a particular person or a particular family, and that looks very different to the more strategic advocacy that we're talking about today, which is aligned with some of the work that, you know, coming out of the Zimmerman inquiry that challenges sort of reforms of the health system more broadly to benefit people and patients in the long term. So addressing those maybe roadblocks that are preventing patients from having access to the therapies that they need when they need them. So if I draw on experience, I think, you know, we found that there is a formula that is quite effective, and there's a few sort of essential elements when you're thinking about sort of system-wide advocacy. And I think you have to have, first of all, a clear ask is really important, and not too many asks, I think, at one time. Just a really clear ask that you think will make a tangible difference to the community that you're representing. The other is really having data or evidence to support that argument. Advocacy is really a lot about selling. So you're trying to convince policies and stakeholders why your particular issue or challenge is important and why it's important to a lot of people. Not only that, you're trying to show them that there is an opportunity for them to really help facilitate that change. So rather than approaching government and politicians knocking on their door saying, this is my problem, how are you going to solve it? You can present them with an opportunity, and sometimes if you're deliberate and you take time to think about it, a solution about how they can deliver that to people effectively. And that sort of advocacy takes time and it takes a lot of thought. The other element that's really sort of integral and makes it easy for politicians and particularly the health minister to come on board is having a united position. So, and I really, compel sort of small patient organisations to think about that. There are a lot of commonalities in the challenges that we faced amongst patient groups, whether you're a large patient group or a small patient group. We're all struggling with a lot of similar issues, and we can be most effective if we unite together with a similar position and we approach government together. And in that way, it becomes quite straightforward and almost a no-brainer in presenting that united voice. I think the problem, and from listening to some of the speakers yesterday, for example, Nicola Roxon, if you imagine sitting in that position and you're bombarded with different requests and they're all compelling, but if you have a group of, say, 500 stakeholders that come together and say at one time, we all want this one particular thing, well, then I think it becomes relatively easy to make that decision. And in fact, it becomes more difficult to ignore. So, there's a lot of talk about when to engage the media, and the media is useful at particular points in time in raising issues. But I think strategic advocacy really requires that united voice, and it's really powerful. And as patient organisations, particularly with the upcoming reforms and opportunities to influence the way medicines are valued in this country, things like national medicines policy, all the recommendations from the Zimmerman inquiry, for example, there is a great opportunity for patient groups to unite together and come with that collective voice and approach government in that way.
Yeah, that was one of the real takeaways from yesterday as well too for me was when Nicola Roxon was sort of, as you say, looking at how do we juggle, with so many worthy causes, but we've got 250, 300 people on this conference today, and that collective voice, as you say, cuts through all of that noise and just says we can realise these benefits and make things happen and get real change happening far more effectively if we work together. So yeah, that's great, thank you. Fiona, can we ask you for some of your insights as well too in terms of advocacy wins and gains?
Look, sure. I mean, it's great to be here today and with, a lot of organisations who at their heart are very concerned about their patients. Congenital heart disease is actually the biggest killer of children under 12 months of age in Australia. And every 3 hours there is a baby born with congenital heart disease. So we currently have a living population of over 75,000 people with congenital heart disease. So it's actually really common. But that doesn't mean it's necessarily easier for us to advocate than it is for the smaller charities, because one of the things with congenital heart disease is we often get the heart disease is the thing people hear, not the congenital. So therefore there's lots and lots of people out there, of which I'm even one, who have heart disease acquired later in life, but it's a very different profile to being born with heart disease. And of the 3,000 babies born every year, 30% of those kids have open heart surgery at under one year of age. So it's a very significant impact on their life. So you would think that with that many people, we would also have a louder voice, but we don't necessarily. So one of our biggest wins started in 2011 when we prepared a white paper with the Cardiac Society of Australia and New Zealand to give to the minister to say congenital heart disease is a real problem and we need you to hear us and hear the voice of our people. So 8 years later, we were then, and I was interested to hear Paul Cross say yesterday that if you want to shut them up, give them a national action plan. So we were awarded money from the government for a national action plan for congenital heart disease, which we then produced. But I was also interested in the cynicism that it doesn't always end in a dead end, because in 2019, the current government awarded $26 million to congenital heart disease. So $20 million of that went into research. And unlike many other research profiles, it wasn't necessarily about prevention. That was certainly a factor, but it's also about living a good life when you have congenital heart disease, and what does that look like? So we've now got 13 research projects moving forward, a lot of which are community focused about, if you've got congenital heart disease, how do you exercise? How do you, we've got gynecology and obstetrics, how do you have a baby? These kind of big research projects are going on to say, so that's great. And $6 million of it was allocated to HeartKids over 6 years to produce a lot of asset for the community. So that was a really good win, but it took an awful long time. And I think if there's one thing that every single person in this room has today, it's tenacity. We don't lie down and die easily. We keep going, and we keep going until our voice is heard. But I think, moving on from what Amanda said, one of the biggest things that HeartKids did was we absolutely went with one voice. And it wasn't just one voice of our community. We actually got the Australian Cardiovascular Alliance, the Cardiac Society of Australia and New Zealand. We got every university in Australia that was working in this area. So not just the patient organisations, but all the other organisations that had a vested interest in congenital heart disease. And we brought them all together and went to the government with absolutely one voice that says, we are the lead agency for congenital heart disease in Australia. We have all these people on our team. And if you listen to us, you don't actually have to listen to 20 other people with divergent opinions and thoughts. We've brought them all together. We've done the hard work. And here is what we think collectively needs to be done for congenital heart disease. So that was really, really powerful for us, was just the ability to sit in front of Greg Hunt and say, we are one voice. This is what we have all agreed we need for congenital heart disease to people with that to have a better life in Australia, to better access to the health system and better access to solutions. And I think that was the real, really important thing. And subsequently from that, we've also then, because advocacy runs across not only government, but also in fundraising with trusts and foundations and those kind of things. Again, one voice, programs that are effective, efficient, and across lots of different other organisations that we come together with. I mean, congenital heart disease is chronic illness. It has the same impacts for people with juvenile diabetes or people with cystic fibrosis. It's something they're born with. So joining hands with other people who have like challenges can also be a great way to advocate. Congenital heart disease isn't an island when it comes to what our families go through. And just hang in there, I think, is probably the most important thing is, two things. The message would be speak with one voice and continue to be persistent. And you will, as HeartKids has done, you will succeed eventually.
That's wonderful, Fiona. Thank you for that. And there are some questions coming through that I'll direct to the panel shortly. But I think picking up on what Amanda and you have said, and is that in that one voice, it's not just the patient organisations while they are at the centre and at the core, but thinking more broadly around the stakeholder group, that there are many, many vested interests, and bringing that collective whole of sort of sector and a whole of issue stakeholder voice is really critical, so that we don't have to do it on our own, and we don't just have to have the patient voice, but bringing that collective voice as well too from that stakeholder perspective is great. So I'm going to ask Agnes to share some of hers as well too, but just broadly for the panel as well, we'll come around and everyone's keen to find out what not to do and what some of the maybe some of the epic fails are, or those those potholes in the road that we all should sort of sidestep as well too. So I'll let everyone have a think about that. But Agnes, some of your insights around wins and advocacy and some of the challenges that you faced.
Well, thank you. Thank you very much for firstly inviting us to participate and just be part of the steering committee. Kate, thank you very much. For me, I would say, I think out of all these stakeholders on this panel, we are one of the youngest advocacy groups that we are just starting. Some of the things that are being said, and I have to go and look it up. As we heard yesterday, there's no rule book really for advocacy, and we sort of self-teach because we are passionate about something, and you've seen the gap, and to stand up because there's no one to support you. So that was the backbone of our organization. We realized that there was no support for our family and our friends, and even though there are other organizations supporting sickle cell patients, that wasn't enough. That's when we stood up to fill that gap. So you see that some of the things we are still juggling, and we still really don't know. And we just, by the way, we meet these people and connections that we actually are able to see. But, in terms of wins and challenges, I would say mostly challenges, but in saying that we've also had some, a bit of wins. For the first time in history, we've seen that the health ministers are able to recognize sickle cell patients, because we have patients that are as old as 70 years, but because, this condition, sickle cell disease, even though it's one of the most common genetic disorders in the world, with over 3,000 babies born annually around the world, with over 250,000 people living with sickle cell trait, which is a sickle cell gene, it's still considered quite rare in Australia. We are talking roughly about maybe, and experts are estimating about 1,000 patients. But in saying that, there's really no system or no recognition until our organization came on board about 3 years ago. So that's a win for us to see that the health minister can actually stand there and recognize these patients, to say you are part of the Australian health system. We see you, we recognize you. That was a very big win for us. And also to have an international conference with over 3,000 people attending, having the health minister himself and the shadow minister participate, and also recognizing and supporting us to see that we recognize your efforts. That's a very big win for us. We've been able to partner with different organizations, with different clinicians. That's the only way that has made us strive and be able to do what we do. But in saying that, we face quite a lot of challenges. I hear about data. That's very important. Government should know this. Everybody knows that. One of the fails for us, one of the things that hasn't really worked for us, is for us to push that data collection. One of the things that we did the first time we started on was to see what we can do as an advocacy group to support the only hemoglobinopathy registry that collects this data. And at one point, they actually stopped because there was no funding. And, I went to a conference where in Scotland right now, there's about maybe 180 patients. They've got a very good system. And in comparison to Australia, we wrote the Department of Health to show them just how easy this system would be if we had to mirror it with Australia. And in saying that, it's not about me, it's not about the patients, but it's about showing how if the government can collect that data and support this initiative, in the end, it will be a win for the government. But as we speak, the hemoglobinopathy registry is barely functioning. They have no funding because they can't collect that data. And because of that, we as patients are suffering, because right now there's medications abroad that cannot be brought in Australia, because these pharmaceutical companies are looking at the number of patients in Australia when we don't have that data. So that's a very, a loss for us, but we're still pushing. But also in terms of partnerships, I value working with different organizations, but what do you do when, as a small patient group, you go to organizations that are doing the similar things as you, and they don't want to support you. They don't want to work with you. We don't get funding, they do, but what we are saying is let us go as a collective voice. These are the issues for the sickle cell patients. As groups that are looking at these patients and issues, let us go together and table these issues to the relevant parties. But what do you do if, as a small group, you are not heard? So those are the challenges that we are having. But in saying that, we have got passionate people in our organization who are using their own money from their pockets to see that our objectives are met. And for the first time in history, people can recognize that you have people who have sickle cell disease in this country. We applied for a newborn screening in 2020, and we are so glad that as we speak, that has been to full review, not implemented yet, but we are hopeful because the minister himself, Honorable Greg Hunt, spoke at our conference and said they are going to do everything they can to see that this is implemented. And we are hopeful that that's done, because that's going to eliminate things like a child being presented to emergency department, 14 months later having surgery to cut half of the lung because they were not screened at birth. All those costs could be eliminated if a child is screened at birth. We have two different scenarios in our group where children were screened at birth and children who were presented late to ED. Now, can you add up the cost for this child who's in hospital every 2 weeks because they have pneumonia every 2 weeks, and a child who goes to hospital every 6 months just for a checkup because all they did was to take amoxicillin from the age of 5 months? Ask me how much amoxicillin is as opposed to 4 multiple surgeries for this child who came into the ED and presented at 14 months and having to cut the lung out. So those are the issues that the government should be looking at. We are growing, fortunately or unfortunately, we have to face that migration is part of us. And we have skilled, relevant people that come in this country to contribute to this economy, and they will be coming. It's about time that the government recognize that and we do something before it's too late. So for now, maybe I'll end there. Thank you.
Thank you, Agnes. And you've hit on one of the points that a number of people are quite interested in. And I ask all the panel to sort of what your insights are around how do you bring people along who aren't prepared to work with you, or you've got those similar organisations, as you said, Agnes, who don't want to have that unified voice. And I guess, you know, in some part, if there is that one area that people do agree on and that you can bring that forward, but that dissenting voice or people operating, I guess, with different agendas is quite challenging, particularly in the rare diseases space as well too. So Fiona, Amanda, do you have any reflections on that?
Yeah, I can talk a little bit about that because I actually didn't talk about what Rare Cancers and the National Oncology Alliance have done in sort of the best case scenario and how we brought people on board with our vision. So, you know, when I say taking one voice to government, it's not something that you can do overnight. For us, it took a year of sort of mobilising people, convincing people, educating them, speaking to experts and really driving that conversation within the community. So we set out with a goal of asking for an Australian cancer plan. It was the first, it would be the first national cancer plan through what we call Vision 2030, where we created an aspirational vision for cancer care for the future. And we engaged over 400 stakeholders. We ran 13 workshops across different topics. We invited about 45 different expert guest speakers from, you know, from patients themselves to experts in artificial intelligence, for example. So it was very, very diverse. And we built that conversation and we built the momentum and we brought the community along with us in that vision. And by the time we had sort of completed those workshops, we put together a report and we put together a framework. And during that time, we also were constantly engaging with the minister's office and other politicians to tell them about what we were doing, you know, and educating them about what the needs of patients are and why we need to have an Australian cancer plan. And in taking that sort of request to the health minister with all that momentum and sort of support behind us, at that time, we were able to really drive that forward, such that our work was the catalyst for, Minister Hunt asking for commissioning Cancer Australia to build an Australian cancer plan. But it didn't start off that we sort of had that vision in mind and we went out and a whole lot of stakeholders agree with us, yes, this is a great thing to do. We really had to be very consultative about that. And in fact, when we were doing that, we weren't saying, well, we're the ones that are going to build an Australian cancer plan. We weren't even talking about the Australian cancer plan. We were really pointing to what needs to be done to lead people along that journey to realise that the end point, yes, is it makes sense to have and ask for an Australian cancer plan.
So building on that and what Fiona said, and also picking up on what Agnes said about being relatively new in this space, a number of people are asking, how do you find those stakeholders? How do you find people who are working in this space or have an interest or doing research or, whether they're pharmaceutical companies or universities, etc. So how do the grassroots campaigns start to identify people with similar interests?
I think from our point of view, it was really in the early days, and it's also important to say that HeartKids started 40 years ago in exactly the same place as many of the people here. We were a group of mums and dads who had babies with congenital heart disease. So it's grown from there. But I think one of the things is to look at articles that are being written by researchers, to subscribe to various research journals, as in an online subscription, to see who's writing, who's talking about it, and reaching out to those people as a start. So who are the thought leaders in that area, talking to them, obviously consulting with your community, because through consulting with your community, you'll come up with the GPs and the specialists that are working strongly in that area, and they will then, through talking to them about what the goals of the patient organisation are, will obviously come on board because it's a passion of theirs as well. And I think the other thing is there are a couple of really good organisations. One is the Centre for Social Purpose, and the other is the Social Impact Hub, that actually bring together lots and lots of charities, from the very, very big charities like the Smith Family or Mission Australia or those kind of areas, right down to the small patient groups. But what it does, it serves connection, and you find out from them how they're going about doing what they're doing. And obviously those very large charities do have people employed to do it and all that sort of thing, but you can always learn from them. And also those two organisations sometimes have funding available to help smaller charities get their foot in the door, but they also have really good workshop programs to teach you about advocacy and how you take the first step, and passion obviously is the key ingredient, but knowing how to constructively use that passion. And those two organisations in particular are really good at helping small charities understand the network in which they're operating, and how they can continue to grow, I suppose. So it was the Centre for Social Purpose. They have a website, and the Social Impact Hub are both really good.
That's wonderful. Great resources. Thanks, Fiona, because mentorships and mentoring in this space as well too, that, there's so many people who've done amazing things and gone before us as well too, who've got those insights and those lessons learned as well too, and achieved some really great things. So to be able to get some mentoring and some guidance in that capacity is really fantastic. So Agnes, any final thoughts from you in terms of hints, tips and things, what not to do?
Well, I guess those organizations that are there to help genuinely, they'll be there. They'll be there to support you. When we did the conference last year, we are able to find supporting organizations that have similar interests. Not everyone is, not willing, but there are other organizations there. I think the zeal is up to you to reach out. So reaching out, as Fiona said, is one of the things, but also looking at, other stakeholders. It could not just be other organizations, but, like clinicians, And, other similar organizations, one of our main supporters, like for example, our local member of parliament, federal parliament, Honorable Maria Van Vakinau, she's been a very big support for our organization. So through her, you get different partnerships and just different, people that work in this space. But what I would say is, it's not giving up, learning a lot and seeing that, for example, sickle cell disease is not so much common here in Australia. We formed a lot of partnerships, international partnerships, if anything. We've got more partners abroad than we have in Australia. So reaching out to different organizations like in America or the UK and try to replicate what they have to sort of help us, that has also been very helpful. So, but also knowing exactly, like, you have to understand, what you're advocating for. It took me 8 years to learn the ins and outs of sickle cell disease, from working in the bank to changing careers to being a nurse, for me to understand sickle cell disease. So it helped a lot. And then now you start, trying to do the best you can.
Agnes. We've just got a couple of minutes left before we wrap up the panel. So are there any final thoughts, Amanda, from you?
Yeah, I just wanted to encourage smaller patient organisations that, when they listen to well-established sort of patient organisations, to remember that everybody starts small. And, Rare Cancers in particular just started with Richard and Kate Vines, and I remember asking Richard about, what did he do in the beginning? And he basically said, any single meeting I could get with any person, I was always there in person, and I never turned them down. So it was just about being there at every single opportunity and talking to people and raising the profile of patient needs and what they were doing to build that momentum. And to get to where we are today as a charity, it's taken 10 years. So it does take time. So don't be disheartened, just keep persisting and keep talking.
Yeah, that's right. Fiona?
Look, I would agree 100%. And I know that a lot of the focus of the organisations here today is government, but also remember that trusts and foundations can be a great ally in looking at what their key objectives are. And so many of the patient organisations here fit those key objectives. They're helping children, better quality of life, all those kind of things. And they can provide you with the seed funding in smaller amounts to actually start kicking some goals and really raising your head above the parapet so that your cause gets noticed. So again, government's really important, but there are other avenues of funding that can help you get noticed. And some of them are very interested in looking at new areas that aren't being explored and aren't being supported. So I think just look, if the message from HeartKids is hang in there, we will probably top $5 million this year, and we started at a kitchen table with a couple of parents who are passionate about helping their children. And if everybody in this room has a great dose of passion, we can achieve great things.
Yeah, look, that's wonderful. It's just you've motivated so many people already. I can see on the chat, everyone's very, very excited as well too. So look, the themes, around that, identifying your stakeholders, partnerships are critical, trying and get a collective unified voice where you can, recognising that it's not always possible. Identify your thought leaders and the specialists who are also working in the field, who want to connect with patient groups as well. Get some mentoring, get some coaching, get some support, Centre of Social Purpose, Social Impact Hub. Not just focus on government, but also trusts and grants, and get some seed funding to get some of those small wins, get that awareness, have those conferences, as Agnes was saying, that, really get the profile out there. But also, yes, it is an election year as well too. So connecting with your local member, make sure that they know that you live in their electorate, that you are passionate, that you have a voice, you're representing a community, your voice matters. Let them meet people who you represent, and as we come back to what Trent said, it's that heartfelt, moving story, that lived experience, that passion that we can all bring, that can actually personalise that journey and be at the heart of everything that we want government to do as well. So thank you, ladies. It's been fantastic, and we really appreciate the time, your insights, and your commitment to your communities as well too. So thanks very much.
Hi, can I just jump in? We've actually got another half hour of time in this section, Fiona, so you could maybe ask some of the other questions that have come through. You've ended a bit short, so keep bringing those questions through from the audience.
Thanks, Kate. And I'm going to claim that that's the Queensland lack of daylight saving time. I kept checking my watch and making an adjustment, but oh, that's fantastic. Okay, well, this is really important then, because when you start, so some of the other things then we did really want to unpack was when you start doing a really concerted advocacy campaign. And I think, Amanda, when you were describing what was happening with that sort of workshop and the 13 workshops around the country and bringing all those stakeholders together. So how does one even start that? Did you engage with, professional facilitators or engagement organisations? Can you just sort of share with us how you did that?
Yeah, well, we actually were going to engage with a professional organisation, but then we found we wanted to do a little bit of work first on to engage stakeholders. So we sort of identified some key areas of focus, such as access to treatments, etc., which is key, and measuring outcomes, and childhood cancers and areas like that. And we sort of wrote a discussion paper, so we had something to take out to stakeholders. And when I say stakeholders, we're fortunate enough to go out to. We went out to industry, we went out to clinicians, researchers. Obviously, we went out to our patient community first, other patient organisations, and really tried to get them invested in what we were about to do. And we did take on some feedback from them. So we did a bit of the groundwork first to engage them. And then we realised when we got feedback that there was a lot of interest in what we were doing, that we could then take that forward with 13 workshops. And we actually never planned on having 13 workshops. We originally planned on having 4 workshops across the country, but then it was in 2020, in the start of COVID, and we realised that, well, we're in this unique opportunity where we could really sort of cover the issues and challenges and opportunities in a really comprehensive way and invite guest speakers. So, we did a little bit of what Fiona talked about. We drew on some of the connections and some of the, specialists that we knew of that were passionate about those issues and experts in the area. And Richard had existing relationships, but in some cases we just contacted people that we had never met, but we knew they were experts in their field. So, for example, there was a professor that I heard speak about artificial intelligence, and I just introduced ourselves and introduced myself and told him what we were doing and asked him if he would be interested to speak. And as a patient organisation, you find that, people are often really compelled to want to be part of that conversation and contribute their expert knowledge to in a way that can really help patients in a tangible way. Because you often find, you've got academics, you've got researchers, you've got scientists, and they're all experts in their field, but they don't ever really get to touch patients, but they want to, they want to see that their work makes a difference. So, I've never ever approached someone sort of, if you like, cold without knowing them and had a negative response working for a patient organisation. So I think the key message is just be bold. We're bold because we believe in, the patients we represent, but don't be intimidated by people that are experts. You'll often find that they're quite willing to contribute their time. They're quite willing to contribute their time for free. So, take that opportunity, just go out there and ask people.
And I think that's particularly relevant in the medical community. And I know that with HeartKids, we have had an enormous amount of support from the paediatric cardiologists and people who are working specifically, and of course, adult cardiologists who specialise in congenital heart disease have always been so good at introducing us to other people and other networks. And we're obviously a national charity, so we have those connections now in every state. And it's a great place to start, because it's amazing how many people those people know who know other people. We also, as Agnes has said, connect with HeartKids or congenital heart disease organisations right the way around the world. And it's also amazing how willing they are to share resource and access. You know, we work with big American organisations. There's HeartKids in New Zealand. There's HeartKids in Japan has just started. With those organisations around the world, they can also give you some great tips and tricks. They also write their own papers. They're also advocating with their governments and writing grants, and because there's such a commonality of purpose, they're always really happy to share resources. We've never had a knockback. And then also within the community because congenital heart disease is quite broad, we also have other organisations that prop up in there which centre around specific congenital heart disease issues. And again, we go and talk to them and find out what their needs are. We have a very active Facebook presence. We've got a very big Instagram presence. Again, even starting small with Facebook pages and Instagram gets your community connected and talking to one another. And it's surprising when you share through networks how many people come up and put their hand up and go, my kid's a heart kid, or, you know, to find out through those mechanisms. And many years ago in another life, I worked in the disability sector, and we had two people with Angelman syndrome at the one daycare centre, but the parents hadn't actually met each other. So as soon as they met and they started talking and sharing experiences, they then took their passion and became a voice for good within the organisation that I was working for, to get better recognition of the needs of people with Angelman syndrome and how they could best get the best service out of the disability service that I was an executive of. So, you know, it's just amazing, even starting small conversations through Facebook posts or LinkedIn posts or Instagram can get groups of people talking and agreeing and sharing information. And once you start that, again, it's a fabulous process. And then sharing information that you might have got from an organisation in the UK or the US with those, again, it's, you know, from little things, big things grow.
I agree with you, Fiona and Amanda. I think in this day and age, there's power in terms of, you know, one of the challenges that we have is for us, I'm sure with any other organization, is connecting with the actual patients that are really going through this. Because of confidentiality issues with the hospitals, you know, we do have partnerships with the hospitals, but it's up to the patients to connect with us. But through the power of social media, especially, you know, one of the things that has, you know, helped during the pandemic is us to come on social media. And we see that we've had a lot of people connect with us because of the power of social media. So we are very active across most social media platforms. We do have talks and education sessions online, and most of the people have come through that. But also what Amanda said, you know, in terms of reaching out, I don't know how many times I've reached out to these random people. All I do is explain and, you know, introduce myself. This is what I do. I've seen you write this paper. I've seen you speak at this panel. That's how we managed to get over 85 experts come and speak at our conference. I think half of those were from international scene. But, you know, also in terms of, you know, one of the examples, funny example I'll give you, like the doctor who ended up treating my daughter, giving my daughter a bone marrow transplant. I saw her on TV. I saw her on Channel 7, and I Googled her and I reached out to her. And 6-7 years later, she was, you know, having a bone marrow transplant treatment to my daughter, all because I reached out. I think that nothing can cost you that. You can reach out to anyone if you try, but it's obviously up to the other person to, you know, reciprocate and maybe able to answer you. But, you know, everything that I do, you know, for me, when I write an email, when I open an answer, I'm expecting a no, and I'm so used to that. and it doesn't even bother me because I'm expecting a no. But if I get an answer, a plus, I'm happy, but I don't give up. I always try and just introduce myself. This is who we are. This is what we do. Can you help? And some will be very positive, but if you're turned down, don't give up, and just continue.
So the tenacity and the persistence is obvious amongst this group. But how much does luck play into some of these timing, opportunity, right place, right time? We can all be incredibly well prepared, but I think there's a bit of luck in some of this as well too. Does anyone have any scenarios or experience where Lady Luck played a role?
Unlike, I would say for us as a patient group, firstly, with a condition that affects, I've said that, sickle cell affects a lot of people around the world, but we're in the minority in Australia. But that, coupled with the color of my skin, I'm just going to put it out here, it's been very difficult. A lot of people won't open doors for you, even some of the people and organizations at this panel, at this conference, because I do believe, and there's evidence to suggest, not my words, Google sickle cell disease and just see the disparities that are in this community. And this is what I'm saying. Every time I write an email, I expect a no, and I'll just file it and then tick, there it is. Because I do believe they are unlike because of the color of the skin of the people that are affected by this condition plays a role. But it's in the 21st century, I just say, give us a chance. We are the experts. Find out from us. I do appreciate and really respect organizations that are representing the majority of the patients, but we are the experts. When we knock on your door, we want you to hear from us. Hear from a mother or a patient going through this who's never been heard for the past 70 years that they've lived in Australia. When we ask for that door, give us a chance. When we bring experts to your office, give them a chance because we are the experts. So Fiona is there unlike in my case, but there've been wins, and like I've said, a few wins, but the losses are there, and I laugh about it, but sometimes it's depressing, but you just pick yourself up and know why you started this from the beginning. Because if we end up getting that newborn screening, you do not know the effect of what it's going to do to the children not going to be born for the rest of this country. So, yeah.
Look, my recommendation would be have a good, what they call an elevator pitch. Have the good, that you can say really quickly and really sharply. And I give you from a previous charity CEO role, I was previously the CEO for Variety, the children's charity. I was standing in a cab queue back before the days of Uber, chatting to the gentleman beside me. I told him what Variety did and the sort of things that we wanted to do for sick, disabled and disadvantaged children. He turned out to be the head of a very large organisation that was looking for a charity partner. And Variety got $250,000 a year for 3 years from a conversation in a cab queue. And because I had a good elevator pitch. And I think it's, if you can talk about succinctly and passionately about what you need and what drives you, it's amazing how many conversations can lead to wins. And that was absolutely blind luck. We were both bored, there were no taxis, we were having a chat. Things like that do happen, and they do still happen. That was 10 years ago, but they do still happen. And I think it's just making sure that when you're talking about what it is that drives you, is make it so that if somebody listening to you can go, I get that, that's terrible that that's happening. The problem that we have in this world is that people aren't outraged enough about what's happening in all your organisations. And outrage makes action. And when I turn around and say to people, every 3 hours in Australia there is a baby born with a congenital heart defect, people tend to go, wow, I didn't know it was that prevalent, or I didn't know that was the problem. I can't recommend strongly enough. Get it down to a really good, you've got 3 or 4 minutes in an elevator, to win that person. And, you know, you can always go and storm Parliament House and trap Greg Hunt in an elevator, give him a 3-minute pitch. You never know your luck.
Yeah, we'll try. We've been trying. We are waiting for that. We got an appointment. We are waiting for that to take our team with us, very prepared. And then the pandemic hit. So we'll try. But thank you so much, Fiona, and you know, keep learning, and I'll catch up with you.
I think it really is. It's really clear to me that the voices that we want to have, some of those accidental voices in our corner as well too. It's the, you know, the dinner party conversation where someone says, you know, guess who I met, or I know someone who knows someone who knows someone, you know, and maybe it doesn't always have to be the patient organisation voice in front of the minister, but, you know, maybe a trusted advisor that the minister knows who happens to play tennis with, you know, someone else as well too. That it's some of it, it's as Fiona's saying, it's taking all the opportunities to educate and to share. And I think Amanda said, you know, there were a number of years and years about educating people and picking up the phone and just making sure that people really understood the core of the issue, and then being able to have that conversation replicate when we're not even doing it, and having those other sort of sponsors or advocates out there that may not be directly impacted by the conditions or the diseases that our patient organisations are experiencing, but are sufficiently touched and moved and yeah, outraged, Fiona, and shocked or disappointed, or even, as Agnes, as you're saying, just the health economics argument alone just makes such common sense that it just defies logic that it's not, you know, part of the newborn screening. And Angelman syndrome is having the same conversations around, you know, the significant cost for late or misdiagnosis as well too. So yeah, so that luck, the elevator pitch, the accidental conversations, and as you say, Fiona, you know, introducing two parents who didn't even know each other, you know, sometimes you get to grow your community through those accidental conversations as well too.
Yeah. I'd just like to add something, if that's okay, Fiona. I think,
absolutely.
You know, also I just think it's really important to remember the power of, you know, the lived experience that most people, even like Trent said earlier, that people assume that the health system is really great, and there are elements of it that are great, but for a lot of people that are living it, and for example, a lot of people that have cancer, particularly rare cancers, they can't get the treatments they need. It's very disparate, it's disconnected, and, you know, the consequence is, you know, that they might die. And unless you've actually lived that or been directly exposed to somebody who's having that patient experience, that real life experience of living with that disease, people living their general day lives are unaware of that. So I think, you know, an elevator pitch is great, and that should, and I'm sure Fiona would agree, that they should include, you know, talking about the lived experience of people, and don't forget how compelling it really is.
We heard yesterday about the role of media in terms of the advocacy, but and that is part of the role of media, is to be able to have some of those stories and share that personal experience in a way that does move people. And we are, across Australia, you know, we are generally, you know, a generous community when we know where we should sort of target our generosity as well too. So it's giving people that opportunity. But we don't all live in big capital cities as well too, or where there's opportunities to connect with stakeholders in those accidental conversations or in some of those structured. So what's some advice for people who are living in regional or more rural, remote areas that are also wanting to advocate for their patient organisation, but have some of the challenges or barriers in terms of access? Any thoughts on that?
I guess, Fiona, as I said, I think the power of social media, and, you know, we've seen that, especially during the pandemic, how telehealth has just changed the whole, you know, health industry. Telehealth has really worked for people in remote areas. Like just the other day we had, I think it's Mount Isa, a patient who lives there, get in touch with us because she saw us on Facebook. So, utilize social media. I can't emphasize enough, because for us, that has really worked for us to get in touch. And also with the kind of whatever condition it is, we are now a global, world where you, by the click of the button on the internet, you can look at the information that you're looking for, but also being mindful, because some of the information you find might not be legit. But mostly if you go to reputable websites, you can find some of the information that you're looking for. And then again, I just, reaching out, social media, and, telehealth scene has really worked for us.
I think we again, it's the connection between families that are suffering together through a journey that, as Amanda rightly says, is often less than ideal. We had an incident just recently. We do have a very big registry of people with congenital heart disease now. But a lady in Mackay who reached out to us, and she's had a friend. They put an ad in the Mackay newspaper to say, is there anybody else in Mackay that has a baby with congenital heart disease? The group up there is now 300 strong, providing peer-to-peer support for each other, and having, great conversations, etc. So again, it's about connecting members of your community regionally, because quite often with many of the conditions that we all represent, that peer-to-peer support is incredibly important. Of having, as I used the analogy of the two ladies with the Angelman syndrome, just sitting down and being able to talk to each other about their experiences and having a total, I get you, I understand how this works, incredibly powerful. They then lobbied the Mackay City Council to support HeartKids to have a coordinator in the area, and we've now been able to, through a grant from them and the proceeds of the Mackay Ball, have been able to put a part-time HeartKids coordinator in Mackay. So from little things, big things grow. But that was just two people connecting with us that we knew about. They then said, well, we're going to put an ad in the paper. 300 families later, and we now have a coordinator in Mackay. So it can happen.
But I guess also with the help of the partnership with the hospitals, if you connect, if you're in the city and connect the doctors to connect you with another family, that has also helped us, where we just say, if they are willing, if you can connect us. That also helps. Working in partnerships with the treating doctors can really help as well.
I think it's a good reminder, and certainly for me, is that the patient organisation also needs to go out and try and find people, and it's rather than sort of saying we're here and you can come to us and you need to find your way to us, is to be able to be active out there in the regional communities and be visible, and working with specialists or even generalists working in the healthcare sector, just reminding people that, to keep an eye out, to look out, for people who may be presenting with, some of these conditions, and then to be able to connect. And so I think we've got a role to play as the patient organisation to be actively out there trying to find people as well too, and particularly when there are things like therapeutics and medicines coming online, and different treatments, clinical trials, etc. Being able to actively know where your community is also builds the cohort and makes it far more attractive to researchers and pharmaceutical companies who are wanting to do some research as well too. And as you say, the registry as well too, and being able to get the data in there as well, is all dependent on actually knowing where people are. But it also affords people the opportunity for good quality standard of care. And that's a critical thing as well too, particularly when we start looking at things like rare cancers or rare diseases as well too, is being able to find people and then being able to work with their care team to be able to implement what is an appropriate therapeutic or response. So yeah, maybe a challenge to all of the patient organisations, sort of what are you doing in terms of reaching out, being visible in social media, being visible in the community as well too, connecting with families, connecting with community to grow your patient base, to make sure that you actually are representing people right across Australia. So yeah, I think that's a really, really great point. Final bit is, though, that I certainly know from an Angelman syndrome point of view, we've got lots of beautiful photos of these gorgeous smiling kids, and of course that, you know, moves the hearts and minds of a lot of people. But what about people who are advocating in some of the conditions that may have some stigma attached, or maybe sort of some more complex, or in some cases, I think the language that was put in the question was vilified or maligned diseases. So advocacy gets very, very hard if you're also dealing with bias and prejudice as well too. Any thoughts for those communities?
I think, I mean, I spent a reasonable amount of time with the Australian Foundation for Disability, and that was an incredibly wide range of people with disability. I think it's more being able to talk about the difference you can make to those people's lives, rather than necessarily relying on the cute baby. It's think what a difference you could make to this person's life if we could do this. And I think everybody who has humanity wants people to have a great quality of life. So my suggestion would be, how do we make it better? Not, you know, that there aren't sweet smiling babies, you know, with scars down their chest, as happens in my area. Not, you know, every child is beautiful to somebody, every person is beautiful to somebody, but to ourselves, we want to make sure that our health system and our welfare system is making sure that everybody lives the best life they can. And I think it's a really strong platform.
I think for me is to remind people just the power of how powerful their voice are, because I've seen this, you know, for the past almost 4 years now, we've been around. Not so much was talked about sickle cell disease, and you find that people are closed off because, you know, historically, people that are affected by sickle cell disease are predominantly, you know, people from sub-Saharan Africa. And in our communities, it's not ideal, it's taboo to talk about health and things like sickle cell disease because you are labeled. You know, sickle cell disease comes with all those complications. One of them is being fatigued. And if you're always tired, people think whatever. So people tend to shy away and speak about it. But the past 3 years that we've been talking, it's just to remind people that the more you raise your voice, it's actually good for not just for you, but for the other people to come to change policy. And one of the things, like especially this year, we're really trying to bring up the patient voice, where we want to encourage people to relate and see that, you know, if this person can speak up, if a child, for example, Hannah, who's our child ambassador, can speak up and say, this is what I go through as a sickle cell patient. If a caregiver like Dilys in New South Wales, who said, you know, my child was screened at birth and I'm advocating for newborn screening. If we have patients speaking, we are trying to encourage others also to see themselves, to see that, you know, I'm not alone and I can also speak up to use my voice to implement change. So it's just about, you know, being able to use yourself, because there is power in the voice of many.
If we've got time, I'll just add one last thing. I just wanted to also say, from that point of view of when you're talking about a difficult scenario where it's not going to really compel people, like cute babies, for example, we tend to bring it back down to people's values and, you know, what do we value as a society and a community, and from a place of fundamental human rights and patient rights. And, you know, what is the minimum best standard that we're willing to accept for every single person when it comes to the delivery of healthcare?
Yeah, and I think that collective humanity, I think, has come through in all of the stories and the insights that the three of you have shared as well too. That it's the passion that's unrelentless, unrelenting, and it's the commitment and it's the partnerships. But we are actually, you know, a collective community, and we heard yesterday it's our healthcare system, And so I think that's a wonderful note to finish on there, Amanda, is that if it's our healthcare system, then what is the standard that we are prepared to accept for everybody who is going to, at some point in time, need to rely on the healthcare system for their own health and well-being. And I think that's the universal thing, isn't it, that brings us all together, is that, you know, we have these bodies that do weird and wonderful things, and at some point in time, every one of us or our family members are going to be touched in terms of disease or illness as well too, and not just from birth and for some of these rare diseases and illnesses, but also, you know, later in life as well too. So that bringing that humanity and that personal journey, I think all of us can learn from that. So I think, Kate, we are all wrapped up, and I'll throw to you.